Wouldn't it be nice to have a less invasive and harmful way to treat cancer, even the types that are resistant to the typical types of treatment? And that's what CRISPR-Cas9 is becoming. Cas9 is a protein that is being used to reduce the need for the use of chemotherapy, which would start making people's lives a little easier even in the trying times of having cancer. But in cases where chemotherapy isn't effective, there's another option called immunotherapy, which is what CRISPR-Cas9 is mostly used for. It can help people who are already suffering from the unnecessary strain caused on the internal organs by the traditional forms of cancer treatments. CRISPR-Cas9 is showing a lot of progress to be a new and better way to treat cancer with less strain on the body. To turn off genes, researchers use a protein called Cas9, the technique called CRISPR interference. That is a quote from the National Cancer Institute. It shows that CRISPR and Cas9, although they're mostly used together, there are different things. Cas9 being the specific protein, where CRISPR is the technology itself. CRISPR-Cas9. The use of the Cas9 protein can help try and turn off the bad parts of the genes and leave the good parts so that they can try and fix themselves, which is unlike chemotherapy, which uses chemicals to treat the affected tissues. But it's not really treating it, it's just killing all of the infected tissue, which can, in some cases, cause more complications than the cancer itself. According to the Mayo Clinic, it can cause severe damage to the heart, lungs, kidneys, and can cause severe nerve damage, which in a lot of cases can cause the death more than the actual cancer itself. With help from this technology in the future, there could be less. Without the help of this technology in the future, there could be even more deaths from cancer, from the side effects of chemotherapy on the organs and the cancer itself. Cas9 opens more pathways because having damage of any of the previously mentioned organs will make it so that the whole body would have more problems, not just where they had cancer. The damage can cause premature death of someone because when the parts of your body don't work correctly, then it affects the rest of your body, and when there's more strain on the different parts of your body's going to be more like to shut down. Using CRISPR-Cas9 technology, the amount of damage done would be very minimal, meaning that the recovery process would be much easier. And more importantly, it will make sure that there is less damage on the rest of your body. Portions of cancer are also considered to be untreatable by chemotherapy or radiotherapy. CRISPR-Cas9 can be used to help in some of these cases, as it's one of the main things considered in immunotherapy. The main component of T-cell therapy, which is the most common form of immunotherapy, is shown to be more effective when the Cas9 protein has been added to it. CAR-T is described as a more natural and being more natural and having less side effects. CAR-T is the main component of T-cell therapy that is possibly affected by the Cas9 protein. It would be a more ethical option to offer a treatment with less side effects and with less chemicals to put into your body. Not only can it help strengthen the concept of immunotherapy, but it also can make immunotherapy more effective, and the more testing they do with Cas9 makes it more effective. Researching this has shown the ways that CRISPR-Cas9 technology can be used now to help a large population and have a large impact on the future of cancer treatments. It also offers a way of being able to get away from the traditional chemical techniques that are used now. Like using the Cas9 protein to practically edit the epigenome could in the future reduce the need for the other types of treatments, making less chemicals packed into the versions that they use now. It would make things easier on the body because there would be less damage. People wouldn't have to worry about the things beyond just the main problem facing them. They wouldn't have to worry about the internal damage or the damage on anything on them, and it would be less taxing. People wouldn't have to worry about the things just beyond the main problem. It also helps when the situations aren't normal. Normal treatments might not work for everybody, which CRISPR-Cas9 might not work for everybody too, but it would give more people an option than without it. It gives more hope to the people. Although some people may say that this technology is unethical because of its ability to be used for basically editing the genetic components of things. It has a bigger good outcome than any of the theoretical bad.